now going to come all the way down onto our back. From here, I want to do a little bit of rotation through the lower legs. So I'm keeping my feet on the floor, and I want to bring ankles and knees together, and I want to keep them together. Arms are going to come out to the sides with the palms up. This is basically going to be our supine hip rotation that we do, except I'm bringing feet to the floor. So from here, we're going to rotate the hips. And as I rotate the hips, I want to keep my knees and my ankles together as I go side to side. So ankles and knees are together. As I rotate, one foot should come completely off the ground. As I rotate over the other foot, the hip should be rotating up towards the ceiling, but I want to keep the shoulder blades soft and relaxed on the floor. Inhale as we bring it up. Exhale as we then let it roll to the other side. And I just want to kind of feel that nice little stretch down into the low back, into the hips a little bit. Noticing how does that feel as we go left side and into right side. Again, nice slow movement with the breath, just to get a little mobilization into that low back area. Good. Now we're going to let both legs go straight. We're going to bend one knee, foot comes flat to the floor. We're going to move that foot out to 45 degrees from our midline, and we're going to get some single leg glute activation. So we're just firing the one leg. I got my right leg down, my left leg is straight. The opposite leg should be completely relaxed. The opposite hip is going to be relaxed. We're going to drive through this hip. It's going to, or this foot, scooping up, and it's going to lift this hip up, and we're going to roll over the other hip. I want this foot to be nice and flat, grounded, spread. I want equal pressure through the heel, ball of the big toe, all the way out to the ball of the pinky toe, and I want the toes themselves to be spread out and grounded as well. I want nice, flat grounding to the floor. We're going to press down through that foot, and we're going to start with just some little pelvic tilts on that side. So downward pressure in the foot. We're going to inhale, let that belly open up as the pelvis tilts, the top of the pelvis tilts up towards the ceiling. As we exhale, navel comes into the spine, and we're scooping. Feel that tailbone move up to the ceiling. Inhale, draws the belly up. Exhale, scoops the tailbone up. And with each one, as you exhale, see if you can feel that tailbone lift up towards the ceiling by planting through that foot. This is just one side that is active. Inhale, bring it all the way back to the floor. Belly opens up. We get this big sway in the back. Exhale, belly presses down into the spine as we scoop, and start to feel that scoop get us higher and higher, so that we start to feel a stretch on the front of this hip, and we start to feel a contraction in the back. Again, the opposite leg is relaxed. As I press my right foot, I don't want my left hip lifting off the ground. If the left hip is coming off the ground, it means I am pushing through my left foot, and that foot should be not doing anything. Left hip is on the ground. Right hip lifts up and rolls over that left hip. Now, next exhale, as we get to the top, we're going to keep it at the top. Continue to feel that nice spread, grounded, pressed foot. We're actively pushing down. We're now going to inhale, exhale, and tilt, but keeping that hip elevated. So inhale, feel the belly open up, pelvis tilts towards the ceiling. Exhale, Draw the navel in as we actively scoop. Feel more of that load stretch through the front of the hip. Feel that contraction more in the glute. I want to feel that glute start to burn a little bit because it's working. We're trying to get some good neurological activation into that glute through the foot. The foot needs to be downwardly pressing. The hips need to be actively scooping in order to get that full contraction of that glute. After we do a good 5 to 10 reps of those, we're going to come back to letting that inhale, the hip drop all the way to the floor. Exhale, brings it all the way back up for another 5 reps. Again, I want to feel that glute starting to feel a little bit fatigued. Let's see if we can get it some work. I'm feeling that tightness in the front of this hip that I was feeling earlier, but it's starting to open up more, and I'm getting some better glute contraction in the rear. Once we finish with those 5 reps, we're going to switch legs. So legs start straight, bending that opposite foot, bringing it flat to the floor, moving it out to about 45 degrees from the midline of the body. Foot is downwardly pressed, grounded, spread and grounded. Inhale, we're starting just with pelvic tilts. Inhale lifts the belly, pelvis tilts up to the ceiling. Exhale, drawing the navel down, pressing the spine into the floor, and actively scooping that tailbone like you're trying to move it up to the ceiling. With each one, as we inhale, feeling that extension of the spine moving up. On our exhale, as we draw that navel in, scoop up a little bit higher. Start to feel that tailbone elevate up so that we start to feel some stretch in the front of the hip. And the more we actively move into that stretch at the front, we are going to start to feel that tightening contraction in the rear. Pay attention to that opposite leg. Make sure that opposite hip is completely soft and relaxed on the ground. That opposite foot is not pushing. It is not working at all. All effort is just on one side. Really start to work into that extension. Start to feel that maximum contraction in the glute. Again, keeping the foot spread, evenly grounded throughout the foot. On your next exhale, at the top, we're going to keep it at the top, and we're going to just work that light tilt. Inhale, belly opens up. Exhale, actively scoop into it a little bit more. And with each exhale, see if you can get more and more of that firing in the glute. I want to start to feel that maximum level of contraction. Start to feel it burn a little bit from the work. After we get 5 or 10 of those isolated scoops, we're going to come back for 5 more. Full range all the way down. Exhale as we actively scoop all the way up. Again, I want to feel that glute starting to burn. I want to feel it evenly on this side as I felt on the other side. This as an activation drill is a good one to do every single day, especially if you deal with any kind of glute inhibition, which most adults do.